my slides. So just to give a brief definition on schizophrenia, it's a long-term mental disorder that deals with, trouble with emotions. It affects your emotions, affects your sight, your sense, and everything like that. So basically, what schizophrenia is having hallucinations, being disconnected from reality. Your perception of reality is false. It can lead to a false perception of reality and everything like that. And you have delusions and pretty much everything with it. So just to give a brief history of it, schizophrenia, was recorded back since like ancient times, since like Egypt, but it wasn't until about the 1800s that a German psychiatrist named Dr. Emil Kraepelin, he came up with kind of, the basis of kind of what schizophrenia is, what is, kind of going on with it, that you have hallucinations and delusion of grandeur, but he described it as being, basically madness, not having a right sense of what is real, basically. And, from his teachings, it kind of shaped how you can kind of look at the disorder and everything like that. So a couple years later, there's another doctor named Dr. Eugene Bueller. He added on to his research that this is actually can be, just a little bit treatable and everything like that. Because Dr. Kraepelin, he has said, it's not treatable, pretty much if you have schizophrenia, there's no chance of really getting better from it. So then we go into the 1900s and everything like that. That's when they led to, them having asylums, creating asylums for schizophrenic patients in like the Victoria era, like in the Victoria era with Victoria, England, and everything like that, to kind of house the schizophrenic patients because they felt like they were like a danger to themselves in society. But that led to treatments like shock therapy, stuff that's not really humane. But it did allow for the first drug to kind of use for schizophrenic patients. They would use sedative drugs. And it wasn't until the 20th century that they started using like I think it's called chlormazine. It's called a drug called chlormazine. Two French scientists used it to kind of help their patients get better. And from there, you got antipsychotic drugs and everything like that. That leads over to the 20th century of, treating the symptoms and everything like that. But that's just a brief history about the mental disorder of schizophrenia. So how it affects the brain. When a patient has schizophrenia, it affects their temporal lobes. The temporal lobes that have to do with declarative memory and everything like that. It also affects their short and long-term memory. And then another process it affects the amygdala, which has to deal with emotions, and it affects the left and right hemispheres of your brain, dealing with, thought and everything like that, thought development, everything like that, and your cognitive tasks, seeing, thinking, everything like that, because you have hallucinations and delusions. And in those, you're hearing sounds, you're seeing things, you're being able to touch things. So it's pretty scary and everything like that, knowing how it affects the brain. Also, it's also said that people who have schizophrenia, schizophrenic patients, their brain matter is smaller than healthier people. You're leaving it to reduce gray matter and everything like that. It's pretty much my slides.
Hello, my name is Misha Hill, and I have symptoms. There are three different types of symptoms. Positive symptoms include hallucinogens, which are hearing voices or seeing people or feeling sensations that aren't there. Delusions, alligated body movements, and disorganized thinking. Negative symptoms include decreased sense of pleasure in life, trouble starting and finishing activities, difficulty maintaining relationships, speaking less, and feeling emotionally flat. Cognitive symptoms are decreased executive functions, which are processing incoming information and decision making, difficulty with concentration and focus, trouble with memory, unawareness that they have a disorder or a condition.
My name is Lauren Thompson, and I will be discussing my PowerPoint slide, which is slide 6, and it is discussing the 4 types of schizophrenia. The first type of schizophrenia is paranoid schizophrenia, which is when you could act off of jealousy or persecution, which it also goes hand in hand with things that could have happened in your past, and you'll begin to hear voices because okay, let me use an example. For example, if you were raped as a child and you never discussed on how you got raped or never talked to anyone, you're not going to be able to know how to talk to anyone. So now you have voices in your head that you talk to or you don't know. You just don't know how to talk to other people, so you talk to yourself. And the second type of schizophrenia is catatonic schizophrenia, which it affects the way you move. You could be completely mute and can't talk to anyone, which also kind of go hand in hand with, paranoid schizophrenia, to where you a past situation has kind of changed the way you don't talk to anyone because you feel as if it could happen. It's like certain things can trigger you, so you can get hyperactive out of nowhere, which is also can get hand in hand with ADHD. So it can sometimes catatonic schizophrenia can get mistaken for ADHD, and you can get misdiagnosed. The third type of schizophrenia is disorganized or hyperphrenic schizophrenia, which is when you have disorganized behavior or speech, and it could disrupt your emotions. Like, you could have mood swings. You could be happy 1 second, or be sad, or be angry, or just be completely mute. And with this type of schizophrenia, hallucinations and delusions are less pronounced. Like, it's not with everyone that has disorganized or hyperphrenic schizophrenia. You don't always have hallucinations and delusions. So that type of symptom can vary, but it's pretty much rare that you have hallucinations. The fourth one is residual schizophrenia, which is when you have a pattern of symptoms where you don't really have delusions or hallucinations or disorganized speech or anything having to do with catatonic behavior. However, there is like evidence of disturbance that has indicated that the presence of those negative symptoms. So pretty much it can be, this is the one that actually triggers past situations. So it's a reason why you have schizophrenia. This is the only one that really is set in stone to where you could say that something in the past had to happen in order for you to get schizophrenia. Other ones, you could be born with it. That's why sometimes people are mute. That's the main reason why people are mute sometimes, because they have catatonic schizophrenia. Or when schizophrenia can also happen when you're in the Army. That's why people sometimes have PTSD. It can come with residual schizophrenia, and that's the main schizophrenia that you have when you've either been in the Army or you've been raped as a child or abused, any of those. But the residual schizophrenia is the only one that really has a reason for it to happen, because it's something that has happened previously or something that's happening present time. So that's my slide. Thank you for your time.
So although schizophrenia is a long-term disorder, there are different treatments used to help with schizophrenia. One method of treatment is called brain stimulation therapy. Brain stimulation therapy is the activating in the brain with electricity. Electricity goes into the brain by electrodes. It's surgically implanted in the brain, or electrodes can be placed on top of the scalp in order to help with the schizophrenia symptoms. One method of one method of brain stimulation therapy is electroconvulsive therapy, or ECT. This method, or ECT, uses electric currents to treat the disorder. This treatment is usually considered if the mental illness has not improved by other treatments. This is the best studied brain stimulation and has been around for the longest. So there's more and more research about this method than all the other ones. The way it works is electrodes are placed on the patient's head and electricity goes to the brain, causing the person to have a seizure for less than a minute. Another method of brain stimulation therapy is vagus nerve stimulation, or VNS. In VNS, a device is surgically implanted underneath the skin and sends electric pulses through the left vagus nerve in the brain. The vagus nerve carries messages to the brain, to the body's major organs and areas in the brain that controls the mood, sleep, and other bodily functions. This method was originally used for epilepsy, but it it can help with mood regulation for schizophrenia patients. The last method of brain stimulation is magnetic seizure therapy, or MST. MST uses magnetic pulses instead of electricity to stimulate the precise part of the brain. MST is not as reliable as all the other treatments that was listed, but it still helps because it's in the early stages of research. So it's not really recommended as much as all the other brain stimulation therapy methods. And so brain stimulation is not the only way to help treat with schizophrenia. There is also psychological therapy, or psychotherapy. This is also known as talk therapy. It is aimed to help a person identify the change in certain emotions, thoughts, and behaviors that a person is not pleased with. Psychotherapy is most of the time led by a licensed and trained mental health care professional, and patients meeting or either one-on-one or in a group setting. Another method of treatment that can be used to help with schizophrenia is also medication. Medication is the go-to treatment for schizophrenia. It's, I guess, not the cheapest, but it's most safest, I guess you could say. These medications are mostly described by a doctor rather than over-the-counter prescriptions. Even though this is the go-to treatment, some patients that have been diagnosed with schizophrenia do not prefer to use medication because of the harmful side effects that may occur to the person or the patient.
So my slide is the relevance to psychology. The mental illness characterized by incoherent or illogical thoughts afflicts men and women in equal numbers and is also found in similar rates in all ethnic groups around the world. Usually starting in adulthood and rarely in childhood, the more developed the brain is bizarrely generating irrational thoughts and leading to chaotic behavior. Psychology is a study of human mind and its functions, and schizophrenia takes over the mind of an individual with currently no cure. There's no cure to schizophrenia, and the relevance that it had to psychology is simple yet complex.